Hi, my name is Rob Moody, and I'm delighted to be speaking to you today um, about the Australian National Preventive Health Agency. I'd like in particular to thank Irene and Ralph for their invitation, and I do apologise for not being able to actually be in Manila because of commitments in Melbourne. But at this point in time, I would really like to acknowledge your work and congratulate you all on all the work that you put in to get the syntax through Parliament, and to wish you well in the planning that you're doing around health promotion in the Philippines. And I'm sure we'll be learning a lot from it in Australia in the years to come. I hope you have a set of slides that I've sent, and I'll take you through these just to give you some of the history around the ANPHA, as it's called, the Australian National Preventative Health Agency. Its roots, I guess, begin in health promotion foundations that were established in the states of Australia, starting with Vic Health in 1987, which was established using a tax on tobacco to invest in health promotion and to remove sponsorship from sports and the arts, tobacco sponsorship that is. That was followed by Healthway and other foundations in other states, and then obviously followed very successfully overseas, particularly Thai Health, I guess, is the one that we all know very well indeed. So in 2008, with a new government, the National Preventative Health Task Force was established. I was lucky enough to be chairing that, and then we established the National Preventative Health Strategy, which was presented to government. The then Health Minister, Nicola Roxton, took this very seriously, and she was very keen to establish the Preventative Health Agency, which was established in 2011 on the basis of a Preventive Health Agency bill passing through government in 2010. And when we look at what were the drivers behind this, what were the really big issues that led to the establishment of the task force and then to the establishment of the agency? Well, the first is the predictions in rising in healthcare expenditure. We know if we look at it from 2002 going up to 2017, then there's a huge rise in healthcare expenditure predicted, both real we now see and predicted, just for cancer, cardiovascular disease, and diabetes, just for three diseases alone. And these are going to take an enormous chunk out of the healthcare expenditure budget unless we can do something about ameliorating their effects or preventing the death and suffering caused by them. Also, we obviously know that more than 50% of these hospitalizations are preventable, and that so much of the suffering due to non-communicable diseases are preventable. We know that more than 7 million Australians, that's a third of the population, suffer from at least one chronic disease. So it's obviously these are big issues related to tobacco, alcohol, and obesity. There's an enormous amount that we can do about them to prevent them and to prevent suffering from them. If you look at the next slide, then it looks at the 7 major preventable risk factors in Australia, whether you're looking at tobacco, blood pressure, overweight and obesity, physical inactivity, cholesterol, alcohol, and low fruit and vegetables. So all these are issues that we can very successfully intervene with, and since we have the political will and the resources to do so. Some of the motivations also behind the establishment of the agency obviously were the ones I mentioned before about the long history of health promotion foundations at the state level, and that had impacted, I guess, very favourably on national opinion and national work, and they were also and have been associated with successful long-term public health campaigns in the area of tobacco use, with road trauma reduction, with the reduction of mortality and morbidity from skin cancer, given that Australia has a major problem with skin cancer. These are just a few of the sort of major public health campaigns that have gone quite well in Australia. And also there's a very long-term history of non-government organisations working with government, working with academia as well, in a sort of tripartite arrangement and tripartite partnership for effective health promotion. The next two slides actually show you decline in prevalence of tobacco and decline in road deaths in Australia. What is interesting about them is, and the arrows represent sort of the points of major policy, new policy, and that might be around pricing, it might be around communications and social marketing, it might be around new laws. But what's important is the number of sort of different policy initiatives that have been implemented and need to be implemented. And the point that good public health, good health promotion basically takes time. It takes a lot of concerted effort. It needs to be comprehensive. It needs to be very progressive and very committed group of people working on it. And what's interesting in tobacco control is we can now introduce policy changes we couldn't do 20 years ago simply because of progress that we've made. So really hammering away at this is very important, and obviously the work that you're doing in the Philippines now is part of that long-term, really hard process that in the long term can produce really good results. And the same for road trauma in Australia. If you just look at the number of people that we think not prematurely died because of good public health interventions, it's probably around 60 to 70,000 in Australia over the last 40 years. And as importantly, 6 to 700,000 people haven't had serious long-term disabling injuries in that time because of good prevention as well. Now if we come on the next slide to ANPHA's vision, then it's really, as I said quite simply there, about where promotion of health is embraced by every sector, by every individual, and it actually includes everybody at the same time. If we then move on to ANPHA's mission, then that's about being the catalyst for strategic partnerships. And it does include the provision of technical advice, assistance to government at all levels, and it also is about initiating sort of health promotion initiatives across Australia as a whole in every Australian community, as much as we can do that. The next two slides shows about functions. This is obviously about providing advice, key recommendations to the Minister for Health federally, but also to the state ministers, and Australia as a federation, so the states are very important, but also to local government, and local government are becoming increasingly important in the provision of not only healthcare, but also in health promotion as a whole, and they're obviously a very important partner in all of this. Other major functions are obviously about collecting and analysing and disseminating information relating to prevention, developing national standards and codes of practice, and managing an awards scheme as well. If we look further at functions, then it's also about social marketing campaigns, awareness programs related to diet and lifestyle, tobacco use, harmful use of alcohol, obviously, discouraging substance use and reducing the incidence of obesity. And this is all done in the spirit of engaging with non-government organisations, with the community sector, with academia, and where appropriate with industry as well. If we go on to the next slide, and you can have a look at some of the governance, then the ANPHA has been established, as I mentioned before, by a special bill established through Parliament, so it's got sort of statutory backing. It has an advisory council, which is a number of senior academics, senior public health experts from the states. It has a number of experts from clinical medicine and general practice, and representatives of the Indigenous Australians as well. Priorities are obviously obesity, tobacco and alcohol. That's in a sense the priorities of the Preventive Health Task Force, and also the fact that this is around focusing on the social determinants of health as well as on individual behaviour as well. So it's not one or the other. It's the notion that we need to be both working at the individual level but also at the societal level at the same time. And two other areas which have been important and are important in ANPHA's work is that of the health promotion, public health workforce, and of supporting public health research, which is of relevance to the practice of the agency and the operations of the agency as a whole. If we come in more detail in looking at the priorities of ANPHA, then the first one is obviously obesity, and ANPHA has been active in the social awareness programs. It's been very active in monitoring food marketing to children. This is a major problem in Australia. They've also been active in building a case or building evidence around what does actually work in obesity prevention at the community level. To be honest, Australia is not doing very well in this area at the moment. Huge challenges for us by virtue of very aggressive, powerful food and grocery council and sector, which is resisting virtually every form of regulation, but we hope that this may change in the future. If we move on to the priorities around tobacco, this is obviously another area, as I mentioned before, we've done actually much better in terms of the National Tobacco Campaign, in terms of plain packaging, which you probably will know about, graphic warnings, and the most important probably really is the increase in tobacco taxation and the increase therefore in price of tobacco, which has been going up over the last few years and will continue to rise in the next few years, and we think that will probably be the most significant factor that does impact on tobacco consumption. Also, ANPHA is involved in monitoring current measures, looking at smoking cessation support, looking at quit line calls, monitoring other aspects of tobacco control. If we move on to alcohol, then obviously the priorities there are really around, I guess, changing the culture of some problematic drinking in Australia. If you look at overall consumption per capita, then this is problematic, but it's not the worst in the world by any means. But if we look at actual binge drinking levels, where people are putting themselves at short-term harm, then we certainly have a problem, and this has actually sparked an enormous amount of discussion and controversy over the last few weeks. But this binge drinking strategy is around community level initiatives, a community sponsorship fund, and a national telephone counselling number and standards, building the case for a minimum price around alcohol, and for advertising restrictions and labelling. Then this is obviously, these are works in progress. It hasn't happened yet, but we're hoping that there will be more and more shifts in the right direction over the next few years. If you look at the next slide, then one of the, I think, important, both symbolically and in real terms, has been the Be the Influence campaign. This is where alcohol sponsorship has been replaced in 16 major national sports, and you can see the picture here, whether that's volleyball or netball or cricket, not in cricket actually, but in soccer, football, very important sports in Australia. Unfortunately, we still have some of the big sports have yet to come under this program, such as cricket and Australian rules football and the two rugby codes. But this has been a major, I think, very important step in trying to get alcohol sponsorship out of sport and away from constantly focusing on young people. And coming up to the last two slides, then research program is an important part of the work done by ANPHA in terms of a real emphasis on translating evidence into effective policy and programs, both in terms of running a grants program to do that and developing a national preventative health research strategy. So we're trying to bring all the major players to focus on a sort of the most important issues that we think. And lastly, just to say, if you have questions or if you want further information, then please go to the ANPHA website, www.anpha.gov.au, and I'd like to finish by thanking you very much for the opportunity of speaking with you. Again, apologise for not being there. I hope you've been able to manage my accent, which I know is difficult, but it's been a real pleasure to speak with you, and just to say how much I personally respect the work that you're doing, and I know so many of us in Australia are really encouraged by the work that you're doing. Thank you very much, and good luck.